Today, 75% of all U.S. veterans get health care outside the VA system. That's approximately 17 million veterans. As nurse educators, this fact challenges us to think about how we prepare pre-licensure nurses as they enter the profession.
Care of veterans is not something that only happens in one specialized setting. It occurs across all settings in healthcare. So it needs to be incorporated across the curriculum in baccalaureate education. My name is Barbara Champlin.
And I'm Rainey Link. We're nursing professors at the University of Minnesota and lead authors on a journal article reporting on the process of how we integrated veteran-centered care and content into our curriculum here at the University of Minnesota. It was through a unique partnership with the local Minneapolis VA healthcare system, which serves over 100,000 veterans in Minnesota and western Wisconsin. Two of our co-authors will now explain the partnership.
Hi, my name is Brad Foley, and I am a nurse and educator at the Minneapolis VA healthcare system.
And I'm Elaine Darst at the University of Minnesota School of Nursing, faculty member. Together, Brad and I are co-directors of VANAP, and that is the VA Nursing Academic Partnership. These partnerships were funded by the Department of Veterans Affairs, and with the intent of improving the care of our veterans in all settings. So it gave us the resources to develop specific area of veteran-centered care within our nursing curriculum.
Military service often leads to specific healthcare issues such as hearing loss or exposure to toxic chemicals. And we believe at the Minneapolis VA healthcare system that an affiliation with an academic partner, a research partner such as the University of Minnesota, can improve veteran-centered care for both the short-term and long-term.
Being in VANAP, I really got to participate in all aspects of veteran care. I got to learn in the classroom about all kinds of things that impact veteran health, including their service and then what they expected when they get home. And then I learned a lot about how the VA actually functions itself and what kind of resources there are for patients.
When we really think about patient-centered care, there are so many parts of a patient's identity that contribute to who they are. And I think that for veterans, their service in the military is really an important part of who they are. And it shaped them in so many ways. The military culture, the transition from military to civilian life, the trauma that they may have experienced, the exposures. And I think learning about vets really enhances how we approach people and how we provide personalized care for them.
This journal article contains veteran-centered exemplars. They're designed for and leveled progressively throughout the curriculum. This way, students can engage with the content at a beginning, intermediate, and advanced level to master content before graduation. One of the advanced exemplars is a series of 9 interdisciplinary simulations that follow the course of a single veteran patient, beginning with an initial admission through multiple complications to the end of life.
We developed an interprofessional simulation scenario that used a Vietnam veteran throughout the course of his health care. So it started with him having a fall, and the scenario progresses throughout an academic period of 9 months, and have them work through the multitude of disease processes that happen when someone experiences a fall, and added on the components of what is occurring with the Vietnam veteran and all the multitude of health factors that enter into that as well.
With veterans now seeking care in all health settings, it is essential that every nurse be prepared to give effective and personalized care to our veterans. We hope that this journal article can help your nursing program achieve this goal.